Repair of blepharoptosis, frontalis muscle technique with suture or other material, e.g., banked fascia. Blepharoptosis is a droop or displacement of the upper eyelid resulting from paralysis. The physician makes an incision directly above the brow, supraciliary. The frontalis fixation technique is a mechanical suspension that transfers the movement of the upper lid to the frontalis muscle above the eyelid. Banked fascia from a cadaver donor or other material such as mersaline mesh may be used to create a sling to the frontalis muscle. Repair of blepharoptosis, frontalis muscle technique with autologous fascial sling, includes obtaining fascia. The physician performs a repair of blepharoptosis by frontalis muscle technique using an autologous fascia to create a sling. The fascia is harvested, usually from the knee, in a separately reportable procedure. The physician makes an incision directly above the brow, supraciliary. The frontalis fixation technique is a mechanical suspension that transfers the movement of the upper lid to the frontalis muscle above the eyelid. It is sutured in place. Repair of blepharoptosis, Tarso Levator resection or advancement, internal approach. The eyelid is everted and the physician makes an incision along the upper posterior edge of the tarsus. The levator complex, including Mueller's muscle, is isolated for a distance superiorly to correspond with the amount of ptosis to be corrected. The levator aponeurosis is advanced onto the tarsal plate internally until the eyelid margin falls at the appropriate location below the limbus. The incision is repaired. Repair of blepharoptosis, Tarso Levator resection or advancement, external approach. An incision line is outlined along the crease of the upper eyelid. A dissection is carried down the normal insertion point of the distal point of the levator tendon. The levator tendon is isolated. The physician uses sutures to advance the levator tendon onto the tarsal plate in an adjustable fashion. If the patient is old enough to undergo the procedure under local anesthetic, the patient is placed in a sitting position and eyelid height and contour are evaluated under the effect of gravity. The amount that the levator tendon is advanced corresponds to the degree of preoperative ptosis. If the patient is not able to undergo the procedure under local anesthetic, general anesthesia is used and a predetermined amount of advancement is performed. In either case, the incision is repaired with sutures once the tendon has been secured in its new location. Repair of blepharoptosis, superior rectus technique with fascial sling, includes obtaining fascia. The physician performs a repair that provides a mechanical suspension of the upper lid, transferring the movement of the upper lid to the frontalis muscle action of the eyebrow. The most common technique involves the creation of 3 horizontal incisions extending to the level of the tarsal plate approximately 3 mm above the upper eyelid margin in the midline, nasal, and lateral quarters. Three corresponding incisions are made just above the brow down to the periosteum of the bone. The lid is suspended in a double rhomboid configuration as the physician passes the suspending material deep in the lid tissue at the depth of the anterior surface of the levator aponeurosis through the orbital septum in front of the bone and out through the medial and lateral brow incisions. The knots are pulled up and tied to elevate the eyelid margin to the level of the superior limbus. The ends of the sutures are burned in the wound. The incisions are repaired with sutures. Repair of blepharoptosis, conjunctivo-tarsomolar's muscle levator resection, Fasanella servat type. The physician everts the upper eyelid and a series of curved clamps are placed across the everted undersurface of the upper lid. All of the tissue distal to the clamps is removed or resected. This includes conjunctiva, tarsus, Muller's muscle, and the distal insertion of the levator aponeurosis. A running suture or purse string suture is used to consolidate the remaining tissues.